excellencies based in Nepal, friends from media, good morning. It is my honor, 74 years long Nepal-US friendship. Today's ceremony marks as one of the very important events. Consignment. I request my colleagues inside the room to play a short video that we can. Seven decades. First of all, I would like to invite His Excellency Randy Berry, the Ambassador of the United States.
Let me just start by thanking the Honorable Prime Minister Oli for the incredible hospitality and warmth that he and his staff have provided not only today but every day to us. I'd also like to take the opportunity to express my sincere gratitude to everyone who played a role in this today, from our own staff members at the U.S. Embassy who have worked some very long hours to make this happen, but also our deep partnerships with our friends from UNICEF, to our colleagues and friends at the Ministry of Health and Population, to our colleagues at Tribhuvan International Airport, all of whom worked diligently and tirelessly to make everything happen without a glitch. The exemplary level of hard work and commitment everyone showed was absolutely vital to what has kept and will continue keeping our U.S.-Nepal partnership working effectively and progressing smoothly. So, as Nirmal mentioned to you, we've just wrapped up an extraordinary moment in our nearly 75-year-long friendship. Earlier today, a shipment of 1,534,850 doses of the Johnson & Johnson COVID-19 vaccines donated by the United States through the COVAX facility arrived in Nepal. I keep saying that number because it's not just 1,534,850 doses of medicine. This is 1,534,850 Nepali lives that are going to be affected and protected. This is a gift at no cost from the American people. And I want to be clear about this. The Johnson & Johnson vaccine is safe, it is highly effective, and it only requires one dose for full protection. This is the same vaccination we are providing to the American people. The U.S. Food and Drug Administration confirmed emergency use authorization after reviewing the safety and efficacy of Johnson & Johnson's vaccine. What Nepal received today from the United States is fully backed by the latest scientific research and has been thoroughly reviewed and tested by the global health community. This has been transparent and it has been data-driven. In our increasingly connected world, the challenges that we face are global, and experience has shown that the best path to resolving such problems is when nations work closely together. And until every person in the world who wants a vaccine has received one, we aren't yet done. That is why in recent weeks, American President Biden has authorized the United States government to undertake a robust global operation to work through multilateral mechanisms and stakeholders. That's important how we are doing this. In recent months, the United States has donated 80 million COVID-19 vaccines to countries around the world, with a promise of many more millions yet to come. As part of this commitment, President Biden announced $4 billion in funding to support COVAX, which facilitates transparent procurement and equitable global distribution of COVID-19 vaccines, including to 92 low and middle income economies supported through the COVAX Advanced Market Commitment. This contribution makes the United States the single largest contributor to the international response to COVID-19, and it builds on decades of U.S. investments in health security, and global health organizations, these multilateral structures that protect us all. All of this demonstrates the Biden-Harris administration's commitment to strengthen multilateral cooperation on the response and in advancing global health. U.S. support for global vaccination efforts follows America's core values: We know that sharing vaccines as expeditiously as they become available will save lives and bring the world closer to the end of this awful pandemic. And our doses come with no strings attached. As a U.S. ambassador, I am so proud to note that the U.S. mission has moved swiftly to support the local response to control the spread of COVID-19 in Nepal, working hand in hand with our colleagues at the Ministry of Health. Since the beginning of the pandemic, the United States has delivered nearly $70 million in ongoing assistance to Nepal. This includes $55 million mobilized by USAID for oxygen cylinders, breathing devices, COVID-19 testing, contact tracing, treatment, personal protective equipment, and infection prevention. In addition to direct health assistance to fight the virus, USAID is also responding to second-order impacts of COVID-19 that threaten Nepal's economic security and social safeguards, particularly prioritizing marginalized and vulnerable communities with agriculture, economic, and education assistance for a more prosperous, resilient, and inclusive society. The United States Department of Defense has also provided $7.3 million for isolation and disaster camps, oxygen cylinders, oxygen concentrators, and non-invasive breathing and oxygen therapy devices, among others. And underscoring our whole-of-government approach, we have also equipped implementing partners across all of our agencies to undertake capacity-building efforts to empower those responsible for the local COVID-19 response. This includes establishing clinical management guidelines and facilitating training. This support will continue to build the capacity of public and private entities to receive, administer, and implement an effective COVID-19 response and public health program. So these efforts underscore our decades-long commitment to the Nepali people. For nearly 75 years, the American government has been working hand in hand with our partners in Nepal to strengthen services and to build capacity. USAID's support in the health sector reflects one of the longest and most successful development assistance programs in Nepal, and I would say in the world. In the last 20 years alone, USAID, in partnership with the Ministry of Health, has invested over $600 million to improve the quality of health service in Nepal. Through USAID's programs and initiatives, Nepal has experienced steady improvement in health and has emerged as one of the very few countries in the world that meet the Millennium Development Goals related to reducing maternal and child mortality. Nepal is also making progress towards the eradication of extreme poverty and hunger and combating HIV/AIDS, malaria, and other diseases. You know, as far back as 1954, just 10 years before I was born, the United States government, through USAID's predecessor, supported the launch of the National Malaria Control Program here in Nepal in 1954, with the goal of eradicating malaria in Nepal. And we all know how successful and vital that program was, particularly for the people of the tribe, really for all Nepalis. In the area of child health, USAID supports the more than 50,000 strong female community health volunteer program in providing vitamin A supplementation, immunizations, family planning counseling, safe motherhood interventions, community-based integrated management for child illnesses, and others. Each year, those volunteers administer vitamin A capsules to 3.5 million children between the age of 6 months and 5 years. That supplementation helps to prevent an estimated 12,000 child deaths per year. And as one of the largest health sector donors, USAID will continue to collaborate with the government of Nepal to save lives and improve quality of life through equitable and well-governed health systems. Our colleagues in the Department of Defense and USAID have been instrumental in our work to enhance Nepal's ability to prevent, to mitigate, and to respond to disasters. We've worked with the government of Nepal to address the needs of vulnerable populations through programs that improve preparedness for and response to natural disasters. Our efforts have been critical in helping Nepalis increase their understanding of the importance of disaster risk reduction measures by mainstreaming them into government planning and budgets. And at the USMC in Nepal, we've also created an interagency disaster risk reduction office to coordinate investments across USAID, the State Department, the government of Nepal, and American and Nepali militaries. So in closing, the example of precedent and what we've achieved today takes us back to an important theme that I noted earlier, that our greatest assets in the world are our friends and our partners in Nepal, in the ministries, through the multilateral organizations, which are critical for helping us combat this global challenge. These challenges over this last year have been daunting, but what I've come to learn very well is that when we work together to pursue shared goals, we're all made better and stronger for that. Partnership remains a critical requirement to weather the daunting challenges created by the ongoing global COVID-19 pandemic, and it will move us forward on a robust agenda that our countries seek to achieve together. Nepal's fight against COVID-19 today takes a critical leap forward with today's arrival of Johnson & Johnson vaccines to protect healthcare workers and the most vulnerable from this terrible disease. But I think we have to be clear, and we are not naive. The real work remains to be done, and so much still remains outstanding. I hope that Nepalis will take every opportunity to take and receive these effective vaccines. Only one dose of these vaccines is required for protection, as I mentioned. And I would also repeat that these vaccines have been produced, tested, reviewed, and authorized with rigorous scientific research and the full transparency of public health studies. Those vaccines that arrive today are the same vaccines that we provide to the American people. We join the government of Nepal, the Prime Minister, in urging all Nepalis to continue practicing safe measures and remaining vigilant and responsible in safeguarding yourselves, your loved ones, and your communities from this virus. Because I believe completely that working together, we can end this pandemic. Thank you very much.
To multifaceted Nepal-US relations and cooperation, including during these difficult times. I'm sorry, Excellency, you may proceed with handover first before that we just.
Honorable Deputy Prime Minister, UN Resident Coordinator, WHO representative, express the profound gratitude of the government of Nepal for providing us grant assistance of 1.5 million doses of COVID-19 vaccines. As we continue to fight the pandemic, the generous cooperation from the USA has been a great soothing gift to Nepal. It reflects our long-standing friendship and cooperative partnership, spanning well over 70 years. I deeply compliment the leadership of President Joe Biden for forging global solidarity and fight against the COVID-19 pandemic. The US has led the example towards ensuring the fair distribution of COVID-19 vaccines. Nepal, together with a number of low-income countries, has benefited from this precious global public good. I recall with pleasure the official communications that have taken place recently between the Right Honorable President Vidyadevi Bhandari and His Excellency President Joe Biden. The two leaders, in their communications, extend their solidarity and views on cooperation in the context of COVID-19, including the distribution of vaccines. The government of Nepal remains thankful to COVAX and its partner institutions for their efforts and timely cooperation of the life-saving source. In addition to vaccines, the generous medical support received from the US has greatly helped Nepal respond to COVID-19 pandemic both at facility and community levels. At present, we are experiencing an alarming surge of COVID-19 cases with about 45% positive rate. The current case fatality rate is 1.2%, which is 6.5% among 60 plus age group. With about 600,000 people tested positive so far, more than 9,300 people have lost their life. The mortality is in a declining trend, with 93% of deaths occurring in the health facility. Nepal initiated the COVID-19 vaccines in January this year with the aim of vaccinating 72% of the total population. Most of our frontline workers have been vaccinated. We have provided the first dose of adults over 65 years. More than 2.6 million people have received their first dose, out of which only 37% has received their second dose. The arrival of single-dose Johnson & Johnson COVID-19 vaccines has significantly boosted our confidence that we will accomplish the vaccination drive as targeted. These 1.5 million doses will be administered to the vulnerable population and people aged 50 to 54 years. Nepal's immunization system has a capacity of inoculating 600,000 people a day. In consideration of our epidemiological zone, effective preventive and curative services are required to combat a pandemic. We are therefore in urgent need of additional vaccines to protect the vulnerable population in the face of this deadly surge. I strongly believe that inoculation is the best available solution of prevent COVID-19 and bring the life into normal. This will enable us charging our post-COVID-19 economic recovery plans. Nepal looks forward to working closely with the United States in our common interests. Last but not least, I put on record our sincere appreciation to our decades-long partnership with USA in the health sector, including malaria eradication and vitamin A program. I sincerely thank Ambassador His Excellency Randy Berry and his team for the tireless work to support Nepal's battle against COVID-19. The government and people of Nepal will always remain grateful to the government and the friendly people of the United States for the solidarity. I thank you very much. Thank you.
I thank you, Prime Minister just mentioned. Today's event will go a long way towards further cementing. Request all of you to join the Right Honorable Prime Minister for photo opportunity outside. This ceremony will